Okay, everybody. If you could take your seats, please. So we have a microphone over here, and I have this one which I can pass around. Thank you all, first of all, for staying. It's been a very long day, but I think a very interesting one. And we have until about 5:30 to continue our discussion. So we don't have any particular agenda for this discussion. I think a lot of interesting things were said and hopefully sparked ideas in people's minds for future work that could be done or maybe clarifications you would like. So anybody who wants to start things off, say something, you can come up to the microphone or raise your hand. I'll bring this microphone over. Yes, Jim.
Open my mouth again. Yes, I know. Now I have to watch what I say. I'm just going to be very spontaneous about the day. I haven't sort of structured anything. What struck me and still strikes me in the whole domain of access to services, it's large in the sense that we have traveled from psycholinguistics and the micro and the science to the large, the population health, vitality of populations and populations at risk. We have not devoted the entire day to the structural issues of how the health system is organized. We've actually spent a lot of time on all those other, they're not peripheral, they are the contextual issues that in the end influence the health system's ability to respond. So it's just a spontaneous comment on the scope and the range of the research. We never would have believed 5, 6, 7, 8 years ago that we would be having a day like this because we really didn't understand what all the pieces were that would interest the research community. So that's number one. Number two, it's that we have a research community. There are researchers who actually want to pursue research. And this is new. This is a field that is stimulating the research community. And for us community folks, we're really excited by that. Because remember door knocking, going through buildings in McGill, door knocking to see if somebody would be interested in looking at us. So to me, that is another major impact of the HCOM program and other investments through INSBQ and others. And I've said enough for now.
Thank you, Jim. Yeah, you're absolutely right. I mean, those of us who have seen this from the beginning realize that now there's actually a kind of culture change that has started to take place. And in academia, people are looking at these issues as legitimate targets to think about for research purposes. And it's good that the community and practitioners and basic scientists are coming together to problem solve on a socially very important topic. Any other observations? Feel free also if there was a speaker today who said something that you would like to hear an expansion on or clarification about. Yes.
So a question for researchers who works in cultural diversity. So my background is in political philosophy and linguistics, and because culture in some sense is hugely important, but at the same time because it's so conceptually vague, I always find it very difficult to operationalize it, especially in any meaningful quantitative elements. So for language, in a sense, is very easy because there's a discipline called linguistics, and it's very ordered and it's very systematic, and it has its own kind of internal tensions and epistemic issues, and that's fine. But there's a discipline out there that looks at this thing called language. But there actually isn't a kind of an equivalent disciplines that look at culture, right? Because unit of analysis of sociology is society rather than culture, and yet we have this huge concept that's been out there for, I think, almost 3 decades now, and are the kind of better and worse way, I guess, of thinking about culture, especially, again, we're moving from nominal to operational definitions.
That's a great question, and a very deep one. And I was looking around the room because one of the people who I know could say something far more intelligent than I could, for sure, is Andrew, and his things are here, but he's not. So would someone else like to comment on this topic? How should we define culture in the context of health services and talking about so-called culturally appropriate ways of dealing with health issues? There are people in the field who, yes, please.
Well, it's more of a comment. If you get culture wrong, there can be serious consequences. And someone alluded to it today, a patient who committed suicide because of an erroneous misinterpretation of something that was said. So that's an extreme end. There are possibilities within an interaction with a clinician if the patient observes that they've been misunderstood, they may be able to correct the communication, or as was suggested, I think, in the presentation by Zoa, I think her first name was, in relation to Aboriginals, there may be a lack of communication as well related to culture. So I'm hoping that in years to come, the consequences of poor communication or miscommunication will be further developed in the research.
Thank you. It's more a comment also. This session today, to me, it's very, very important. And when I look at that, it's when I think 10 years ago, that was not possible. We did not have those kinds of sessions. And what I've seen is that in the past 5 years, we had many of those colloquium or symposiums that we talk about the importance of language, communication, and service, and so for the well-being of the patients, of the person. So me, from a policy point of view, what I can take from all this information, like when I look at the titles today, there was sparks of ideas. Okay, this is what we can do with that. So this is how I think, like in terms of policy. So what kind of policy we can use, how we can use information. So what I see is that some of this new information can be used in the initial trainings of health professionals. So it's not in the curriculum now. So like we talk about the use of interpreters, how bad it could be to use a children. Like it should be a no-no, but how can we train health professionals initially, like in their 4 years training? Say it's something that you never do, so, but it's not part of the training. So also in this initial training, the importance of communications and culture. There was a presentation today about that. We assume that culture is not important or language is not important when we train our health professionals. Then there's this is something that's not easy to change. But then there's the continuous training. So how can we use this information, the new research, to change how people are, so they go to forums, they go to symposiums, how we can use that for their continuous training so that we can put those ideas in their minds and say this is how we should interact with patients. And then there's how we can use this information to make some changes in the health system, like we had a presentation in the hospital. So how they can be more effective using this new knowledge, but also creating tools that they can be more effective in the health system.
Thank you. I think part of what you're saying is how strategically should we move forward. We've seen that a kind of almost a movement that started 10 years ago here And I have to say, I think it was also true in other parts of the world. There were little groups of researchers here and there who were asking interesting questions about health and communication and barriers for minorities, but nothing systematic was happening. My own feeling is that we, as a group, we need to be strategic, and that means, in part, it means publishing a lot, because the agencies are always, my experience is the agencies are often behind the research community, en arrière of the research community, not behind in the sense of supporting, but in the sense of being late. And by publishing more of the research that we do, we change the climate, and then people realize that this is in fact an important topic, and that scientists and graduate students and so on are doing this work, and therefore money has to become available to do this work, because that's what people want to do. One of the things that has pleased me is to see, after about 5 or 6 years of this having started, was graduate students were starting to come in on a more regular basis, and they were just assuming that this had always been a topic, of, a valid, important topic of research, not realizing that just 5, 6 years earlier, almost nobody was doing this. So that's a good sign, and I think we just have to keep moving that more and more. Yes, Jennifer.
I have two things. First one is and I've mentioned it to a couple people already, so I'm sorry if I'm repeating myself, but there was a piece of research that we did, the CHSN, I'm Jennifer Johnson, I work with the Community Health and Social Services Network, on interpretation. So we have a report that was published in March 2016 about what interpretation services exist in Quebec, how they're organized, how they're used, and the experience of people who have used or haven't used interpretation services. And there was a very large sample of people that were interviewed for that piece of research. So it's I think fairly valid and interesting complement to some of the work that you're doing. And I would suggest you go to our website and look it up. It's on it's in our document center under CHSN Publications. And then the other piece that I wanted to bring up that I feel, just compelled because of who I work with on a daily basis. There are over 1 million Anglophones in the province of Quebec, and 600,000 of them live in the CMA of Montreal. However, there are another 400,000 that don't live on the island of Montreal and don't live in the experience that you're studying in the city of Montreal. The reality of trying to get health services, access to a bilingual professional in the Gaspé, the North Shore, the Estrie, the Abitibi is extremely different and more complex than I think in a big urban center where you have hospitals dedicated to the English community. And so I just always want to bring that to everybody's back of their mind so that when they are planning their research, they think about, these 400,000 Anglophones that are not able to walk into the McGill University Health Center and speak to a health professional in English. It's more walking into their local CIS and fighting their way through the barriers that they faced from information services all the way to the diagnostic services.
So, Andrew, at the risk of breaking or compromising a very long, strong friendship, a question was asked earlier while you were out of the room, and I thought you might have something interesting to say in answer to that question. Okay, so I'll repeat. Do you want to repeat the question, or?
Okay, I just want to follow. I want to follow on something that you said in your presentation about the interdependence of language and culture. So one of the things that one of the things that keeps baffling me. So my background is in political philosophy and linguistics, and of course, culture, multiculturalism, of course, is now a very big part of liberal theory. But there's a very big issue of operationalization there, because for language, there's a whole discipline that looks at language, and they have various definitions and there's an intellectual history of thinking about language, but there isn't anything equivalent to that with respect to culture, because for sociology, the unit of analysis is society, and yet culture is becoming this hugely important and yet kind of strangely analytically vague concept. And how does one go about that when analyzing intercultural communication in multicultural societies, in multicultural political communities, or policymakers are trying to, find a way of creating a better, more just, more efficient society? Do you have any thoughts on that or any ideas?
Yes, so how do you define culture, Andrew?
Oh boy. Well, I'll try to keep it. I'll try to keep it brief. I think it is, obviously, it's complicated, and different disciplines have different ways of dealing with it. So yeah, in sociology, the unit is the society. In anthropology, there has been a move, I think, from the unit of analysis. It was a lot easier in the 50s when the unit of analysis was the culture, right? The sort of more or less bounded meaning system. That has faded, and I think with good cause. And in multicultural societies, there are as many problems created as there are solutions when you start blocking off and saying, this is this cultural group with these properties, and these people are in it, and here's another cultural group, and we'll name that, and it has these properties, and so on. I've found it useful to see culture as a kind of a placeholder for what anthropologists, or some anthropologists now call this the local world or the local social world. So it's the system, or the sort of the interconnected system of meanings, and then practices that are rooted in those meanings, that are shared within a particular community that interacts. And of course, they interact in many ways linguistically, although they also interact through gestures and rituals and all sorts of other semiotic signs that aren't language in the narrow sense. And I think that it's useful to see culture in that way. And then for any given study, we might want to talk about Anglophone, let's say, Anglophone Jamaican immigrants or something like that who'd rather use English than French. And there are research advantages to delineating a group, and for the purposes of your research, saying who's in and who's out. And then the trick is not to see that as some kind of reified, essentialized category that exists in the world, where everyone who is in that category has certain characteristics and are clearly in it, and everyone else who's not in that category is clearly out of it and doesn't have those characteristics. Does that make sense? So the cultural group as a useful research fiction, and perhaps as a meaningful identity, might be the label that people use to call themselves, but it doesn't mean that we have a kind of clear, category. Although language actually is not so clear cut either. So if you go to you go to the Ukraine and Western Russia and ask people to tell you where Ukrainian ends and where Russian begins, right? It's pretty easy to see the differences when you're in Moscow versus Lviv or something like that. And as you get closer to that frontier, you get shades and gradations. And then within that, of course, different people use the language differently, have different degree of aptitude, and at a really micro level, speak with different accents and have different voices and have different things they choose to talk about. And I think that culture is broadly, sort of, at least analogically similar to that. Mhm.
Into kind of more macro theorizations, I guess. Is there a way?
Uh, yes, I think there is. But again, I think the challenge is that I sort of see it pragmatically, is that you would do that for a specific purpose, a particular function, right? So, like I said, for research purposes, it might make sense to draw a line and say, okay, this is the group we're talking about. The same could be said for public policy, that you want to talk about a particular group or a particular identity. But as you get closer to the frontier, just like as you get close to the Russian-Ukrainian language frontier, you should expect fuzziness. And you have to sort of remember that within the group you've talked about, there's going to be all sorts of internal variation. You're making the choice to minimize that in order to reach a particular public policy goal. But for a different public policy goal, you might need to draw the line in a different way. And any further elaboration would take more time than we have. But I'd be happy to talk about it more.
So just one my little comment on that. So I read a lot about cultures, and so again, this is, you're right. This is not a field of research that it's not one block. So it's a very researchers from different groups that have studied culture, but it's been more used in the I would say the work environment and business environment, and much less in the health sector. Like the importance of culture, different cultures in the health sector has not been studied a lot, but for business, it's been done for many, many years, because this was obvious. Like if you want to do transactions with people in Japan, so you need to know how they think, how they do approach negotiations, and how they communicate, what they don't communicate, and they do communicate what would say gesture and so on. So it's been studied in that area, but much less in the health sector. Like difference between task-oriented people versus people relationships. They want to develop relationships before talking about the problems. So it's been studied. Same thing with being indirect or versus direct in responding to questions. So sometimes they will talk about many things before responding directly to the questions. Those fields have been very well studied in the business sector.
Yes.
Hi, I just want when I came in today and I saw people making presentations, I accompanied Jim a couple of years ago when he was knocking on doors, and I was following him around. And it really struck me, hey, I've been doing research on this population, on the English population, on minorities, and right across Canada, but the English population in Quebec specifically. I found that they were right on the line. This was right in the areas where problems were arising, where we had no data and no information on Aboriginal populations, on populations, on ethnic minorities, on immigrants, components of the English population which we're wondering about. There are a large number of questions raised about it. And we don't know the influence of various factors on health use and where it's going. And today we see people, I saw people today discussing this kind of issue, okay, which I had never thought we would get to that particular point. So I really want to commend the people that were dedicated over these years that made this happen. Thank you very much.
In terms of the strategic application of all this work, I know we have another couple of days coming up, and I'm looking forward also Saturday when we kind of do the super wrap on all this. But just some thoughts. There already is strategic opportunities in the research that's been produced today and in the previous period. Just to give you a couple of examples. The epidemiological studies that the INSPQ has produced are very important. They influence policy. When we talk about the INSPQ and their mandate in Quebec of informing government and government policy on population health, and when the INSPQ says we recognize language as a determinant of health and quality of health, this is a huge policy shift in an institution that did not distinguish the population along the lines of Anglophones, Francophones, Allophones, and that horrible expression, autochtones. So this is a policy impact. When the INSPQ says, when we did the life expectancy studies and we took a look over the next decade plus of data we think will reinforce the declining socioeconomic status of English-speaking population and the effect on life expectancy, we're concerned as the body that informs policy that we'll see an increasing gap in health status inequality within our population between Anglophones and Francophones. So this is policy impact of research that has come out of this project and the associated research at INSPQ. On a more practical level, the impact of some of the presentations today with regard to the professional challenges, the challenges of professionals in providing services in English. This has a direct consequence in terms of how the McGill project, working with ourselves in the ministry, maps out the future around language training, the future of applications, and other tools which can fit in this now environment that we have in the health system that professionals can have instant access to. The other has to do with the standards and quality concern, where those of us in the community and also the ministry looking at quality within institutions, that the whole drive towards looking at accreditation and accreditation standards. So when you're talking about a psychiatric unit that is dealing with all these issues in emergency, so you ask the question, how do those problems get translated up into users' committees, whether it's First Nations working within a complex system or a group of clinicians involved in emergency psychiatry? Where does that travel up? Where does the change take place institutionally? Where do you have routine access to interpreters in an emergency situation in psychiatry? So where that impacts policy is the drive now to look at accreditation, an institutional obligation around quality language and the delivery of services. So those are just 2 or 3 examples of where this research is already, the rubber is already sort of hitting the road.
Any other comments? Well, it's getting close to 5:30. Again, I congratulate you all for your stamina, and we look forward to seeing you tomorrow, and we'll have another interesting day, I'm sure, of presentations. Thanks, everybody, and we'll see you tomorrow.